Good morning, good afternoon, and good evening. I'm delighted to have been invited to do this talk to you all today at the third annual UK Implementation Science Research Conference. And my presentation is going to be looking at the challenges and successes of implementing policy into practice, utilising examples from maternity national policy in the NHS and the impact of COVID-19. So we're going to be covering in this talk a shared purpose, the importance of having a shared purpose in order to achieve the aims that you set out to achieve. Asking the right question, something about system drivers, how we present our research, what infrastructure do we need to deliver? Let's look at some transformational leadership that is important if we want to make sure that our ambitions and hopes and that the research that we have applied will be applied. Some examples will be used from NHS England to demonstrate these things. And throughout the talk, I'll be referring to how the global crisis around COVID-19 has impacted. Finally, just a word about cutting-edge research, which will steer our future. So what's the context for us here in England? We have 750,000 births in England per year and approximately 130 NHS maternity services delivering care to women and their families across the country. We have the highest levels of deprivation in Liverpool, Middlesbrough, Manchester and Hull, and London has the highest population of refugees, asylum seekers, migrants, second only to New York City. So that's our country and that's our population, just a little bit about both. So what are our drivers within the NHS in England that we can use to drive and implement the important elements that we hear from our researchers? So we have mandates from the government. We have the National Maternity Review, which was undertaken and published in 2015, published in 2016, chaired by Baroness Julia Cumberledge. Better births, improving outcomes for maternity services in England. We are in our final year of delivering on the Better Births ambitions. However, that year has been hijacked by COVID-19 and therefore we have had to move our aims and our timeframes further on, which is one of the impacts of working within this global pandemic. We have our interim NHS People Plan, which helps us to see and understand how we can get the best out of our NHS workers, the most important workforce that we have and the most important resource. And then we have our NHS Long-Term Plan, which is looking ahead from taking forward from the Better Births Maternity Review into the next 5 years, 5 to 10 years, what the important elements of the maternity programme are. We work with our key partners. You can see the logos there of the key partners that we work with. Importantly here, the Academic Health Science Network, of course, very important. So what is our shared purpose here in the NHS in England? So all of these things are really vitally important. We need our system drivers. We need to be able to project manage what we're doing and putting into place. What change management tools are we going to be using and improvement tools? How are we going to create spread and adoption? And how are we going to measure, really importantly, and also motivate and mobilize the people, our very, very important resource, and leading to make sure that our women and families in England get the best care that they can. It's important to ask the right question. So what is the National Maternity Ambition? It's described there in the box at the top. But the question has to be phrased around what the imperatives are at that time. So it's really, really important that researchers work together collaboratively with the policymakers, the implementers, the doers, the strategists, the chief midwifery teams, the non-clinicians, the directors of transformation. Really important that there is co-design going on to make sure the right question is asked. And how we present our research. So you can see on one side a very clear academic paper, which is fine and we know is what's needed in order to drive that research forward, to get it published where it needs to get published, etc. However, to take the next step and make it informative for the very people that are going to be using the research to drive change is really important. So you can see here an infographic. I've used one that we used for continuity of care, which is an example that I'm going to use later in my talk. But you can see the difference here, the importance of having a very easy to read, easy to pick up aspects around the research that can be transferable to women, their families. Anyone can be drawn to understand more about that research by looking at that infographic. So the system drivers, I want to talk a little bit about how in NHS England the system drivers have been used to drive the change that we've seen in the two projects that I'm going to outline. So we need levers to implement policy. We need a very clear infrastructure. We've got our Department of Health mandate, we've got Better Births, and we've got the long-term plan. We've got our NHS standard contract, and we have financial incentives. So it's really important, though, that we translate that into engaging with the right people, ensuring we've got the right data, that we're having the right dialogue with the people that we're going to be working with. I've already talked about the importance of co-design. It's so vitally important. We've got to win the hearts and minds of the people who are going to be implementing our studies. And the only way to do that is to co-design them with those very people. Decision making, we need brave people who are going to be able to make decisions despite the odds necessarily, and be courageous in making those decisions. We need investment in order to implement and then of course measure so that we can get the impact that we really need to achieve. The infrastructure in the NHS in England, we are incredibly privileged to have the very first Chief Midwifery Officer for the NHS in England. Jacqueline Dunkley-Bent, Professor Jacqueline Dunkley-Bent was appointed only just over a year ago, April in 2019. And she has been able to put together this structure. 2 Deputy Chief Midwifery Officers, again England based nationally, and 7 regional chief midwives that cover every single one of the regions in England. Vitally, vitally important infrastructure to deliver the ambitions. And this is our maternity transformation programme. Also very, very important. We have project managers within this team. We have some clinicians, we have non-clinicians, directors of transformation. It's a really important team that we have. Working nationally, led by our Maternity Transformation Programme Board, chaired by one of our chief execs from our maternity services, our NHS trusts in England, which is also really important. Involve the people who are going to be delivering the change that's needed. So the planning guidance ask every year we refresh our NHS plans and we have planning guidance, and it's really important. I'm using this example to say how important it is to have influencers who are going to ensure that the results of your research are going to impact on the change that we need to see. And so that needs to go into your planning guidance or some similar national driver, so that there is something that people have to do. It's a must do, it's a mandate, rather than if you can or whether you can afford it. So these are the elements of the continuity of care piece of work we've been doing, and I'll be talking about, that are in the planning guidance. Really important in order to get to get our transformational change that we want, that is based on the evidence and research that you all provide for us, we have to have the right leadership. So we need resilient leaders who can design from the heart and the head. We need leaders who can be empathetic, but also be clear about what they need to achieve and how they're going to achieve it. We need leaders who will put the mission first. These elements, I should have said, elements 1 to 5, come from an article that Deloitte's have put together that is specific to managing or delivering resilient leadership and responding to COVID-19. So you can see here that it's imperative that the mission is held tightly and put first. So despite how much stabilizing you might have to do when you move through wobbles, and well, it's more than a wobble, a tidal wave of COVID-19, you have to stabilize, but you also need to prioritize and ensure that you don't lose sight of what the mission is. Speed over elegance, really important that decisive action is delivered with courage. Expediency is necessary when we're looking at things that we want to put in place to save mothers' and babies' lives. Seize the narrative at the outset, own the narrative. Acknowledge what we don't know, that's a really important point here. But paint a compelling picture of the future that will inspire all of the wider team around us and our people in the NHS to persevere. Stay focused on the horizon and spark innovations that will define tomorrow. And I think those last 2 points, particularly points 4 and 5, has been demonstrated by Professor Sarah Gilbert, who's leading the research in Oxford to find a vaccine to COVID-19. So the examples that I'm going to talk you through from NHS England are continuity of carer, the delivery of continuity of carer, a national campaign to deliver continuity of carer to women and their families, and the Saving Babies' Lives Care Bundle about reducing significant reduction in the rates of maternal and neonatal mortality. So continuity of carer. This is an example. I'm going to go through the points that I made earlier. This is an example of how an infographic has been used to really capture the attention of our services, of our people, of our women, of their families, in order to be able to push for a complete change in the model of how we deliver our services. So it's really important that we have eye-grabbing, sort of mind-grabbing headlines and research that's translated into bite-sized chunks. So it's 19% less likely to lose your 19% less likely to lose your baby before 24 weeks if you have a model of midwife-led continuity of carer. That is a bite-sized chunk that's nice and easy to have a dialogue and to narrate to women and their families, and to services and to finance directors, etc. This is really important. Success factors. This is just to demonstrate to you the success factors that we have been able to see with the implementation of continuity of carer in England. So it has been important to make sure that we define what we're going for correctly. We need to make sure we've got the right numbers in place, sufficient numbers of midwives to birth ratios. So we need to define what we want to do well, and we need to deliver it well. A clear implementation plan, commitment. So that's strength of commitment at the board or at the trust level, at government level, as I was saying earlier, the drivers, the system drivers to push a trust board or a trust board or a trust level to really open their eyes and grab their attention. Policy and finance, you have to address that. Make sure we've got government level of commitment, and we have had that through the Better Births Review and the long-term plan. Resourcing, willingness to change. You really need to work with the people and co-design what we're trying to do, so to make sure that you win hearts and minds as you work along the pathway of change. A strong core team is really important in order to deliver this particular aspect of continuity of carer. ongoing evaluation and feedback, and a really supportive management approach. That is so important when we're implementing large-scale change. Partnership working imperative between managers, union, professional representation. Make sure, as I said earlier, that we're bringing our people with us. Proximate leadership. This is also something about, we're only going to really see large-scale change if our leaders help to drive that by becoming proximate with the midwives, with the doers, with the people who are on the front line delivering the change. And this is a slide, a picture of Professor Jackie Dunkley-Bent on one of her visits that she went out, did 26 visits in order to talk about the importance of delivering continuity of carer. 26 visits by our Chief Midwifery Officer out there talking the talk and explaining and getting close to the midwives and clinicians who are delivering this change. We need to demonstrate effectiveness, as I said earlier. This is an example of that. So one of our local maternity systems, our LMS, has shown early findings indicating that with the delivery of continuity of carer, women are more likely to give birth at home and have a lower rate of elective caesarean births. So this is a real clear example of how ongoing research and evidence can motivate the people that we're working with to say, this is the right thing to do. Keep going. We're doing well. We can't stop. We've got to keep our goal in mind. And we found along the way further research. This is so important that we have ongoing research to demonstrate that actually, so we're doing okay, but we now know that that outcomes are worse for our Black, Asian women, minority ethnicities, women from the poorest parts of our geography. They have the poorest health outcomes. So we really need to be ready to target those particular groups from our ambition is from 2021 and beyond, but actually it's happened now. We have a moral imperative to act now, and that's what we're doing. So just to talk briefly about the Saving Babies Lives Care Bundle. Similarly, this has been written into the NHS long-term plan. We have a driver for it. We have it in policy. We have our very own Secretary of State pushing for a reduction in maternal and neonatal mortality and fetal mortality. So we have the drivers there, we have the evidence there to say we have to do it. And now we're working towards implementing this. We are implementing, and we have implemented, the Saving Babies Lives Care Bundle in order to address this issue. And there are 5 areas of the Saving Babies Lives Care Bundle: reduction in smoking, risk assessment and surveillance of pregnancy and fetal growth restriction, raising awareness of the reduction of fetal movements, effective monitoring in labour, making sure staff are competent in this area, and reducing preterm birth. So you can see here that we're doing quite well. However, stillbirth rates still remain high in some areas. As I've just noted, our black population, Asian babies, those most deprived, these are still what they are not what we want to see. The UK rate is 3.74%. So why is it higher in groups of Black, Asian and minority ethnicity? Why is it higher? That's a question that we need to have answered by our research scientists and our groups of scientists that are working away. So within this, we need those questions to be asked, and our research scientists to help us to get a complete picture. We are approaching our work within the NHS in our maternity work as a life course approach. We know that this is what's required to meet the ambitions that we have. We need to look at how do we get better outcomes through pregnancy, through the antenatal pathway. within our intrapartum pathway and also postnatally. How do we improve our outcomes along the whole life course that we see in front of us here? And this is again where we need to work on specific areas where there is higher risk with our researchers so that we can understand where we need to put our resources. So what are we achieving? This just demonstrates that by working with our research community, by working with ensuring that we target our resources at those most needy areas, we are seeing improvements, but there is so much more to do. So implementation of change that relates to the research that has been done in the midst of global crisis, well, it's really tricky. It's really tricky. It's disheartening because we find ourselves moving towards a certain target and then this huge, the rug is pulled out from under our feet. However, we have to manage the barriers that come our way, and we have to do it in a way that takes our people with us. So we are needing to balance the desire within us to improve care for women and babies with the workforce that we have who are weary, who are battered, who are suffering from anxieties because of COVID-19. So that's where we're at now. We're having to provide leadership that brings our people with us. And what we're finding is that there are pockets across England of groups and maternity services and clinicians who are reinstigating the teams that are providing continuity of carer, that personalised care for women and their families, despite the barriers that have come their way. So that's good to see. And we are envisaging that moving forward, we will be able to get into restoration, that we will be able to work with our teams to really get back on track with the ambitions that we have. And of course, in the midst of any crises, we see opportunities emerging. And this is what we look to our research community to help us to really grasp hold of opportunities that come our way so that we can work effectively, efficiently, making a difference where it really, really matters. So it's really important that we have cutting edge research which will drive the future to improve the care that we give to our women and their families, to drive down stillbirth rates, neonatal mortality and maternal mortality, to ensure that we are always striving for the very best we can for the health of our people, of our nation and of our futures. So now I'd just like to say a very big thank you to all of you for listening this morning, for working with us, for helping us to get as far as we have got in terms of delivering on our ambitions for maternity services in England. And this is a picture of some wonderful midwives in England, and we all want to thank you on behalf of our mothers and babies, and we look forward to working with you in the future.